Hello, we are from the Occupational Therapy team here at Derriford Hospital. Big question, what is occupational therapy, or also known as OT? OT looks at individuals as a whole being, their mental and physical health. If you have a health condition or illness, we would help you achieve your full potential and independence. Those who have contracted COVID-19, this can affect your everyday life, including cooking, cleaning, washing, dressing, getting out of bed and going to work. Therefore, rehabilitation is essential for recovery. COVID-19 can also affect someone's mood and cognition. Throughout this video, we will look at tips, activities, and also links that you can do at home if you have or recovering from COVID-19.
One thing that would be helpful for you to do to aid with your rehab and recovery from COVID is to set yourself some goals. Compared to when you were feeling well, you may feel now that activities that you would have done without a second thought are far more difficult and tiring at present. To help combat this and monitor your progress, you could set yourself an overall goal of what you would like to achieve, and then break this into smaller steps to build up to your main goal. When thinking about the types of goals you would like to set, think about things that are meaningful to you. Setting goals are beneficial for your recovery so you can measure how far you've progressed and gain a sense of accomplishment from your achievements. And this will also not only just increase your confidence, but also your motivation. This can then make what you thought may have been an unattainable goal seem more realistic. To keep yourself accountable and track your progress, you could make a log of your goals and achievements so you could visually see your progress. You could even share these with your family members who can cheer you on with the amazing progress you're making.
So to help you achieve your goals, it's really useful to use a technique known as pacing. So when recovering from an illness, you are likely to have less energy and feel tired. And simple daily tasks such as getting washed and dressed, cooking and cleaning can feel like really hard work. So it's easy to fall into a pattern known as boom and bust. So this is where on the days you're feeling well, you do too much activity, making you feel worse for longer and needing extended periods of time to recover. So pacing is a way of preventing your symptoms getting worse. And by using this technique, you'll be able to increase your activity levels without exhausting yourself. So the overall aim would be to be able to maintain an even level of activity throughout the day, instead of doing as much as possible in the morning and feeling exhausted and needing to rest all afternoon. So one of the main things you can do to help you pace your daily activities is to build in rests into each task, as this is key to recharging your batteries. So it's better to take a short break before you need it, rather than waiting until your symptoms are flaring up and then needing to take a longer break to recover. This way of managing your daily activities can be shown quite well in this diagram. So A, B, C and D represent different types of activity, and some activities will be physically demanding, some mentally demanding, and some emotionally demanding. In this example, each activity is done in a big chunk, one after the other, leading to the person having to rest for an extended period of time. By using pacing, you can reorganise your day to become more balanced. So if you divide up the 4 tasks of A, B, C and D into smaller and more manageable tasks, to avoid taking extended breaks, and split the rest time to create shorter breaks throughout the day, and this way you'll be able to increase your tolerance. So the 3 principles of pacing are to plan, pace and prioritise your activities. So if we take, for example, the activity of cooking, you can make this activity less tiring through first of all planning your task. So when you're cooking your meal, think about whether you can make a larger portion and therefore have one put in the fridge or the freezer for another day. Think about getting everything ready before you start your task, and find a recipe that doesn't take too long to cook. So then you can pace this task. So one really good thing to do is to spread the preparation throughout the day. So you could peel the vegetables in the morning, cook in the afternoon, and then reheat the meal in the evening. You can sit down to prepare the food, and you can take a rest during or after cooking. And then you need to prioritise. So for those days where you're going to be feeling more tired and it's a bit more of a struggle, think about buying ready meals and having them available for yourself. Or if you're able, ask a family member to cook for you on certain days of the week. So you can also use pacing to plan your week. So you can do your bigger activities such as gardening, shopping, cleaning and laundry on different days, with quieter days in between. And this way you'll be able to build up your activity. So once you're managing your daily routines without causing a flare-up of your symptoms, you'll be able to start doing a little bit more over time. So try and introduce a small amount of a new activity or a bit more of an activity you're already doing. And finally, for those of you that need to or want to return to work, this will be different for each individual depending on your recovery and also on the type of job that you do. We find a phased return to work is really effective. So where possible, have a discussion with your manager or your occupational health department to see if this is something that you can do when you go back to work. So the overall aim would be to increase your hours and the days that you work and also the tasks that you're doing at work over a number of weeks. And you can use your principles that you've learnt of pacing to help you with your return to work.
It's becoming increasingly clear that many patients recovering from COVID-19 are also experiencing cognitive problems. Cognitive difficulties are estimated to be present in up to 1/3 of hospitalised patients, but may also affect those that haven't been hospitalised. There is also increasing evidence that COVID-19 impacts the brain sometimes, resulting in neurological problems and conditions, for example, such as stroke, which also impact on cognition. Cognitive impairment is one of the 3 most common persisting symptoms 6 months post-COVID.
So it's important we are aware that difficulties are more likely to become apparent once people are at home. So, what is cognition?
Well, the brain is endlessly active. It controls everything we and our bodies do. Yet we don't notice most of our brain's activity as you move through your daily routine. Put simply, cognition is thinking, acquiring, processing, and using information from our senses, knowledge and experiences.
How did COVID cause difficulties with cognition?
So the underlying mechanism remains unclear at the moment and is still being researched. But it could be that it's the body's response to the virus, an autoimmune response to the virus. It could be low oxygen levels, or it could be that there are certain areas of the brain that are vulnerable to COVID as a virus.
What aspects of cognition are affected by COVID?
So some people, particularly those that are critically ill, say in ICU, can sometimes experience something called delirium. So this is an acute disturbance of cognition, causing confused thinking, disorientation, and reduced awareness of their environment.
So what can we do to help?
Well, particularly when you get home, a familiar environment is obviously really helpful, familiar routines, and to be around those that we know and love.
So how did orientation affected by COVID?
So it can alter. Orientation is about us knowing where we are in time and place and knowing the people around us, so that also can be impaired.
So what can we do to help?
So trying to link people into time through having clocks available or orientating them to their watch, using things like newspapers if that's something they'd normally do, or watching the news, using calendars, and repeating tasks also.
How did it affect your attention?
So attention is what we commonly think of as concentration. So if our attention is impaired, it can make it hard for us to focus and ignore distractions. So focusing on a task and conversation might be difficult, or it might be difficult for us to divide or alternate our attention within a task between 2 or more things.
So what could we do to help our attention?
Well, the best thing to do is to quieten the space really, take away the distractions, ask others to not disturb us so that they're aware, and also to take regular breaks.
And how did it affect your memory?
It tends to affect short-term memory, so it will mean that it's more difficult to hold memories on and information in your mind. So you may struggle to recall something that has happened, or for example you might forget to take your medication.
So what can we do to help our short-term memory?
So there's lots of really simple strategies that we can use, lots of external aids that everybody uses every day. So things like having a notebook by the phone so that you can jot information down that you may forget otherwise, using a diary or a calendar to plan out your time and remember appointments and things. And also obviously now we use our phones so much, so calendars and reminders on our phones, and there's actually apps, memory apps that you can use that are specifically set up for people with memory impairments.
And what about executive function and how that impacts upon you?
So executive function is what we would think of as our higher level thinking, okay? So bringing all those skills together to enable us to solve problems, make decisions, organise and plan ahead, to see tasks through to completion, and also to self-monitor and have insight and awareness to, what we're doing really.
And so how can we help with that?
So it's good for people that have difficulties with executive function. They obviously find it quite difficult to plan and organise. So good idea to kind of break tasks down, plan out for either an activity, the day or the week. Make sure that you're taking plenty of breaks through, making checklists and incorporating kind of stop and think time so that you encourage yourself to self-monitor and check whether you're on track.
And so how can we help with that?
So activities like getting washed and dressed, cooking a meal, the things we take for granted really that we can do day to day, walking the dog, it's looking at those activities, looking at how we can break them down, maybe do a part of them, grade up to doing a full activity. So also using what we call the 3 Ps, so looking at planning for a task, prioritising what is actually important to do and what you want to be able to do, and also pacing yourself. So you could also use what we think of as remedial activities to work on specific or a combination of cognitive skills. So there are lots of brain training activities out there at the moment that you can get on apps or in kind of notebooks and things, board games, cards, all those kind of things that are going to challenge your cognition, get you, having to concentrate, having to remember, having to plan.
What other impacts of cognition are caused by COVID?
So obviously this is a really stressful time at the moment, so things like fear, stress, anxiety and low mood all impact upon our ability to think clearly. And also, as will be discussed in another element of this series, fatigue is a big issue also. So what we generally think of as tiredness, and again that also impacts on our ability to think clearly.
So what do we do if we find that we're still having difficulties with the things we've talked about?
If you still have concerns and you think some of these ideas aren't really, making the difference that you need them to, and you're still struggling with activities of daily living, then it's a good idea to go to the GP and ask maybe if you could have a referral to the occupational therapist or psychologist.
The pandemic has placed different stresses on all our lives. Some of us are feeling scared, low in mood, lonely, and with the sad passing of so many people, also experiencing grief and loss. In order to keep us and those we care about safe, please be aware of changes in our own behaviour and others, such as not sleeping, sleeping too much, feeling angry, loss of hope and joy, and also changes in appetite. As occupational therapists, we would suggest reaching out to others, friends, family and professionals. Please know that you are not alone. We will attach some useful links to this video of support services if you would like someone to talk to. You never know that a phone call could be the first step to feeling better or helping others to feel better. We are also lucky enough to live in a very connected world where even though we can't see people in person, we can see them online using apps such as FaceTime and Zoom. Some ideas of activities you could do to prioritise your own mental well-being could be as little as spending time outside with your support bubble, reading, having an exercise routine, trying relaxation or mindfulness techniques, keeping a gratitude journal, or baking. This is a challenging time, but it will pass.